the things that people don't always know about a lack of health insurance is if you don't have health insurance, you pay a higher price. Because everyone with health insurance gets a discounted rate. Now, even when I do this often, discount or waive an office visit fee for a person without health insurance, how do I waive the echocardiogram payment? How do I get the endoscopy charge? The patient has to negotiate all of these all the way down the line. This is a poorly able to see, but this is an article that was published by my organization, American College of Physicians, Achieving a High-Performance Healthcare System with Universal Access, what the United States can learn from other countries. We looked at other countries, and it sounds like you're going to be looking at other countries all of this season. But what we found were pretty interesting things. That compared to other countries, we have a costly system with poor access and equity, an inefficient system, and we aren't even that good at keeping people healthy. This is the data that was talked to you before. Here's the U.S. Our per capita costs are high. Actually, Maryland's higher than that. Here's New Zealand, a country we would all say has pretty good health care. And here are most of the other nations that you're going to study this year. We have more trouble with access. 51% of sicker adults in the U.S. were asked, did you have any trouble getting your prescriptions filled, seeing a doctor when you were sick, or did you ever skip things because of the cost of it? Anytime you're paying 20% of something, or you have a big deductible, that price can hit your budget pretty hard. So 51% of United States sick people have trouble. One of the things that's very different about the U.S., and this is really important as you look at every strategy you look at for improvement, is primary care score. This was by Barbara Starfield from here. And what it shows is that the U.S., which has low primary care, spends more per patient. Steve Kravitz at Bayview, some of you may know him, has shown that increasing proportions of primary care physicians greatly decreases the emergency department visits and surgeries and hospitalizations. The U.S. could save $10 billion a year if we went from 35% primary care physicians to 40%. Most of the countries you saw in the center of that chart run at about 50% primary care doctors. Now, why don't we have more primary care doctors? That is a complex question. The interest in primary care in the U.S. is dropping off dramatically. This is 1999 to 2006. These are internal medicine subspecialties. This is family practice. Pediatrics is yellow here, and this orange line is internal medicine. Medical students graduate with as much as $250,000 of debt. $150,000 of debt is enough to make you say, I don't think I'll do primary care. I can't afford it. So it's not unusual in a private medical school to be way above $200,000. So it makes it hard to make those choices. In addition, because we have a hospital center training situation in the U.S., you don't see primary care doctors. The better the primary care, the less the patients in the hospital. So you're not going to be taught in settings where the primary care is the best because it's not visible. Most of you spend most of your time, those of you who are medical students, being trained in inpatient settings. ACP proposes that for a high-performing healthcare system, that every person should have coverage. We think that universal coverage can be achieved by a single payer or by a mix. The patient-centered medical home. This concept is one to really watch as you look at proposals. our care in the US is not patient-centered. It is not exactly doctor-centered. It is, I guess if you wanted to say where is the center is in the hospital. The center is in the insurance companies. The center is in the public-funded things like Medicare. But I think the thing to remember is that if your records aren't all in one place, how can you possibly have patient-centered care? The records are everywhere, and it's hard for the patient to have access to all of them. 59% of physicians support universal health care. This was amazing news that came out this spring. Indiana University looked in 2002 to find out what percentage of doctors favored universal health care. It was 49%. Here in 2008, we're at 59%. You can see the psychiatrists lead the way at 83%, emergency medicine specialists at 69%, my group, internists, are at 64%. The people who aren't listed, you'll have to look at the article to find out where they were on it. So when you look at people who work in your community, think, do they have health insurance? But after you think that, think, do they have access to care? It will be a tremendous irony if the U.S. gets universal coverage and there's no primary care system to deliver care to these people. And we're at big risk for that.